I'm Edie Lush, and I'm outside the Hub Culture Pavilion here in Davos. I know I look ridiculous, but a man who does not look ridiculous is my guest here, Professor Olivier Oullier. Now, you're a member of the Executive Committee at the World Economic Forum, and you're the Head of Strategy, Global Health and Healthcare. What is going on here?
First, you look amazing.
Thanks, man.
You embody the fourth industrial revolution.
I love it. Why?
Because we're recording the activity of your brain with this white device. We're recording what you're looking at the moment with these goggles. And if we combine this with something that captures your emotional reactions on your face, then we can better understand how you think, how you decide.
I actually don't even know where to go with this. It's amazing. So what is the forum, what are you doing about healthcare this year in Davos?
This year is incredible in terms of healthcare at the forum. We've got more than 50 sessions. It's the topic that has the biggest coverage. One of the key projects that we have is called value-based care. It's about improving the quality of healthcare for people.
What does that mean?
It means that we are trying to reduce the cost of healthcare, to reduce the waste in healthcare delivery. Every year, there is between $7 to $8 trillion that are wasted when we are taken care of in hospitals by GPs. It's incredible. It's 30% of the money we spent in healthcare that has been wasted last year.
So how can technology help?
Technology can help in many, many ways. Think about what is called electronic medical records. Well, if you do something in one hospital, another hospital might not be able to read it. So you would have to start again your medical exams.
Right.
And this has a huge cost. Technology can help this way, for example.
Tell me about what are robots doing in healthcare? What do you think they're going to do?
Well, we have robots at the moment that are able to perform a certain kind of surgery, and this is amazing. If you use this technology with surgeons, we can understand where they are looking at when they're performing surgery. We can understand also when they are getting tired and it's time to take a break. We can use this with nurses or with your physician to know how to design an interface to capture the best information about you so that the next time you come, there are no mistakes in the records.
Now, I know that before you joined the forum, as a neuroscientist, you worked with games and healthcare. Is that right? Tell me about that.
Yes, I worked with the gaming industry in order to make, well, people say games addictive, but let's say that to entice people into playing a lot the video games. We can use this technology in order to better understand how patients need to be informed about following their treatment. There is a huge problem and a huge waste with antibiotics, for example. Every time you feel better after taking antibiotics, most of the people, they stop taking them. And it has a cost several months after. So this is one way to do it. The other way where technology can help is with robots. We have one fantastic one in the conference center that allows basically to help people learn. It reacts to your emotions. We have Dr. Justin Cassell from Carnegie Mellon University that brought a totally virtual assistant that is able to react to your emotion, to learn thanks to the way you move, the way you talk, and that can help people. This assistant, for example, will have so much empathy that it will be able not to tell you the things you don't want to hear because it understands better your emotions.
That's incredible. Actually, I remembered even a couple of years ago a survey, or when I went to USC and looked at virtual reality. Actually, patients want to talk to a robot more than they want to talk to a doctor. They were happier to share personal information with somebody that they thought was AI rather than a human being.
And you know, the AI behind is going to help them with this kind of interaction, with talking. But Davos opened with Vice President Joe Biden talking about the cancer moonshot. And when you look at what we have learned over the past 2 years in terms of cancer treatment, it's incredible. This is the fourth industrial revolution. From the technology helping you to communicate to your patient, to the technology allowing today to contain cancers that people were dying from 5 years ago. And this is incredible. And the forum is on the forefront in the project that we're leading together with the Boston Consulting Group on this front.
What do you expect to hear or to learn from what I'm giving you right now?
I expect to realize that we're still really good friends, Edie, that you're still happy to see me despite
I am.
everything we said.
Despite what you've made me do.
Exactly.
What you've made me
and
wear.
that next year when I see you again here at Davos, you will not hold this against me.
Never. Olivier, thank you so much for stopping by the
It's
Hub
always a
Culture
pleasure. Thank you so much.
Pavilion here at Davos, and I'm Edie Lush.